Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physical therapist and physician advocate, and she brings together Tonya Caylor, family physician and physician coach, and Nikolai Blinow, mental health counselor. They all wrote the Kevin MD article focusing on well-being versus wellness, what it means for physicians and their patients. Everybody, welcome to the show.
Thanks, Kevin.
Thank you.
Thank you.
All right, Kim, as always, we start with you. How did you find Nikolai and Tonya, and what brought you all together?
Yeah, so LinkedIn once again. So Tanya and I have been connected for quite a while, but we hadn't actually had a conversation until fairly recently. And Nikolai had actually recently reached out to me. And I was going to interview both of them. And right before that, I happened to go for a walk with one of my best college friends, who's also a PT, who unfortunately has some disabilities now. She lives with chronic illness. And she happened to mention to me that the term wellness doesn't resonate with her, that it feels like impossible now for her to be well,
Mm-hmm.
and that she prefers to use the term well-being because she feels like that more accurately reflects how she feels and functions in daily life. And as you know, I've been calling myself a fierce advocate for physician well-being. And I was thinking, well, maybe I've been using those terms interchangeably. So when I interviewed Tonya and Nikolai, I asked them if they'd mind unpacking that for me because I figured they were both more experts in the area than I was. And we had such a great conversation. I thought it would be important to expand that to a wider audience. So that's why we wrote the article.
All right, well, thank you so much. So, Tonya, you're a family physician, a physician coach. Just tell us a little bit about your story, and then what does wellness versus well-being mean to you, Tonya?
Yeah, well, thank you. So I was core faculty for years up here in Alaska and had my own burnout story before I actually knew that was a term. And in the recovery process, I hired a coach, not because I needed help there. I was actually doing quite well myself, but I was missing some things. So I hired her more as a career coach. And through that, I was able to join one of her groups and saw the power of coaching.
Mm-hmm.
And even though we think about the burnout being so related to organizational systems, realizing how much agency that 20 to 40% gives individuals with coaching. And so I was like, okay, this brings together everything I love. I love residency education. I love well-being. I love medicine. And now I love coaching. And so I started my own coaching business working with family medicine residency programs with faculty, teams, and residents. So to me, wellness started to feel probably during the pandemic started to feel very performative, right?
Mm-hmm.
So it was something that was prescribed for you to go do wellness activities, and it felt very binary. You were either well or you weren't, right? And so when a lot of the GME academic leaders, Tate Shanafelt, Carrie Palomar, and others really started to shift their language to well-being, it felt right, right? Because it was being well. And it was multifaceted, not just your physical health, but your emotional and psychological and relational and financial, et cetera. And then Tate Shanafelt like stretch it to this whole other level of team health and systems health. And that resonated. And so that's when I started using that term.
And Tonya, just in terms of your own coaching business, so tell us about how you're implementing that distinction between wellness and well-being among the clients that you are talking to.
Yeah, I think mainly is helping them identify where it is in that multifaceted part of who they are, of the areas that they have the biggest opportunities to grow and feel and be more well, and then really helping them exercise their agency about how do they go about that? Do they need boundaries? Do they need to work on mindset? Do they need to just exercise their agency and their influence in the cultures that they're in? So that's one of the biggest ways.
Nikolai, you're a mental health counselor. Tell us about, of course, your story a little bit, and then how your world intersects with some of the clinician stories that you hear about or that you read about on Kim's LinkedIn feed.
Yeah, so as you mentioned, I'm a licensed mental health counselor. I actually made a career change early on in life because of becoming burnt out in my first career. So that 20 to 40% that Tanya's talking about, that There's systemic issues that can leave us susceptible to burnout, but there's also internal issues. I think I can definitely speak to that because I was burnt out before I was in the medical field as a licensed mental health counselor. And I know for myself now, I'm also a late in life diagnosed ADHD person. So I navigate the world differently. And a lot of my susceptibility to burnout is not just related to the systems that I'm in, but also just the fact that my brain functions very differently. And as a super high performing ADHD person, which I think there's a lot of people out in the world who fit that, my hyperactivity that comes with the ADHD also has manifested throughout the years and being really productive, maybe a bit workaholic, and struggling with regulating myself. So I became a therapist because I want to do meaningful work. I want to help people. And I would say early in my life, when I was more burnt out, I've always been what we would say, wellness oriented person. I grew up, I think, very, very concerned with prioritizing my nutrition and my fitness goals. And I would say I was checking off a lot of boxes for being a well person. And yet I still was feeling burnt out. So when I think about reflecting on what is the difference between wellness versus well-being, and kind of tying into the question you asked Tonya as well, I think the difference is, and in myself and also with my clients, encouraging to be mindful, practicing mindfulness on a daily basis. And when I say mindfulness, I really just mean observing within ourselves and also in the world that we're existing in, just what's working for us and what isn't. And I think when we think wellness, that tends to be, and I think being a therapist, I think a lot about language and the power of words. So goal oriented, so externally focused. You know, we're trying to eat nutritious foods. We're trying to get enough cardiovascular exercise. Maybe we're trying to abstain from unhealthy habits like smoking. Those are all wellness goals. But I think when we use a well-being sort of frame of reference, it's encouraging us more to have a practice of checking in with ourselves about what's working for me today and doing that checking in over and over and over again.
So Nikolai and Tonya, you're both coaches, and obviously you see a lot of clinician clients. So I'm gonna ask both of you the same question, and that's this: among your clinician clients specifically, you said that maybe 20 to 30% or something like that is due to systems, but the rest is something that they could work and recognize and improve among themselves. So Nikolai, I'm going to start with you. So any themes that emerge among your clinician clients in terms of how they present to you, and any commonalities among them that they could improve on when it comes to well-being?
Yeah, I mean, I think a lot of clinicians are very high performing and also highly empathic people. Not all, but the nature of becoming a physician, right?
Yeah.
And Tonya can attest to this. Kevin, you can attest to this. There's a lot of goals that you have had to achieve to end up doing the work that you're able to do. And I think sometimes with clinicians, turning off that almost goal-oriented brain can be a real challenge. With the burnout data, what I often tell my people is basically the data shows us that we really need to be allocating rest, and rest is as much of our productivity process as everything else that we're doing. And about 40% of our time should actually be spent resting. Sleep counts, so that's good because a lot of us are sleeping. But if you take a 24-hour day and you calculate what's about 40% of that time, it ends up being around 10 hours. And most of us as adults with lives, either working in a practice or a hospital, or maybe operating our own practice, you know, maybe we're sleeping for 6 to 9 hours. And that means every day we should be making active rest part of our process. And I think a lot of physicians sometimes struggle with that because you are all so naturally high achieving and doers. And I also think understanding that rest means you have to rest your nervous system. And so sometimes I see clinicians or physicians whose methods of rest are going through that wellness lens, they might be running,
Mm-hmm.
right? And that's very good for them. But really, what their nervous system might need, if they've been seeing patients back to back to back to back to back all day, running on that particular day at that particular moment actually might be very aggravating to the nervous system. And they need something that feels more restorative. So I think trying to help people find those patterns within themselves. And I think a lot of physicians want to make their patients healthy and better. And so sometimes boundary setting, whether it's with patients or with colleagues, I think most of us are drawn to this kind of work because we care and we want to have an impact. And so we also have to do our own internal work with figuring out maybe where we could let go of guilt
Mm-hmm.
when we maybe can't do all of the things.
And Tonya, what about you? Any common themes that you're seeing among your clinician clients that prevents them from achieving that goal of well-being?
Yeah, I have to, I would say it's 60 to 80% of systems and organizational things. So I can't not mention those, right?
Mm-hmm.
But in addition to those common themes, because it's just really hard, especially in primary care, to do all that you want to do and all that is expected of you. And that leads to this tension. And if you combine that, some of the common themes that I see, again, that maladaptive perfectionism,
Mm-hmm.
that all or nothing thinking really gets in the way. Like if I dial it back and I only deal with a few of my patients' most important problems rather than all of them, it's either I'm going to be failing, I'm mediocre, right?
Mm-hmm.
It's just like a binary switch. So I think helping them figure out how they can deal with the realities that we are in instead of arguing with reality. Like, okay. And so getting away from that idealism and what you can do for this person at this time. And then I think the other thing really is there's a lot of socialized narratives in a lot of I primarily work with physicians, but in physicians' minds, where there's a lot of negative narratives. And it
Mm-hmm.
goes back to like Nikolai was saying, like that guilt, like I'm not doing enough. I'm not being a good enough mom and a good enough
Mm-hmm.
doctor and a good enough team member and a good enough friend, right? Like there's a lot of negative, and that's why so much of the work is mindset. And I also just want to like acknowledge that every individual, and I know Nikolai sees this too, while there are themes, the solutions and the unpacking are so individualized
Mm-hmm.
that there's not like a prescriptive, do these things and you're going to feel better. And so I think those are some of the biggest ones I see. I will mention in trainees, some of the biggest things are they are still feeling like they've left medical school and they still are feeling like they're on the stage. Like
Yeah.
they have this performance oriented, like, and when they're there, when they're in that state of mind and they're performing, they're trying to hit all the boxes. And if they get feedback that there's an area for them to improve, they only see that and take that personally as they failed.
Yeah.
And so I think there's so much within the mindset piece, in addition to some of the other structural pieces that people can put into place.
And to that point, Tonya, I think just the fact of getting into medical school, right? They have to jump through so much hoops. They literally have to be perfect, whether it's GPA and MCATs and then clinical rotations, right? They have to be performative in a way to get to that point. And all of a sudden, we're telling them to change their mindset to be less performative, to be less perfectionistic. And that's very difficult for a lot of doctors, right, Tonya?
Oh, absolutely. Totally. And again, it goes back to like, well, the fear, like if I stop doing it to impress people or to show people what I know, what's going to happen? So it's that transition to learning to trust that this is part of the process. And if they're doing it for the person in front of them, if they're learning for their own sake and for their future patient's sake, it helps them make that shift. But absolutely, what got you here isn't going to get you there, you know, that saying, right? And that performance orientation is one of those things.
And Kim, after interviewing Nikolai and Tonya and hearing their perspectives in terms of wellness versus well-being, tell me some of the key points that you've learned after talking, spending time with them and listening to them here and interviewing them on your own podcast.
Sure. So perfectionism comes up over and over and over again, and how that is an obstacle. And then also being productive. And it's interesting because I've had found that in my own life is the feeling of always needing to be productive,
Hmm.
even when you're home and, and being able to say, okay, well, I did this, I did that, like I was productive, or I have to do all these things and then I could rest, right? Where you don't have to earn rest, as Nikolai pointed out, that rest is so so important, and that needs to be built in. And also, interestingly, what I'm finding is I think being built into being a physician is you're going to let people down.
Hmm.
It's part of the job, either like diagnosis wise, you're going to have to tell them hard things. And also with your work as doctors, when you get called in or you're on call, you might have plans with a friend. And even for myself, when I have conversations with doctors, sometimes we get interrupted.
Hmm.
They have to go to the hospital, something comes up. And so many doctors have told me, like, I'm sorry, I'm sorry. Just in my work where all I want to do is support doctors. So to give yourself some, grace and understanding.
We're talking to Nikolai Blinow. She's a mental health counselor. Tonya Caylor, family physician and physician coach, and of course, Kim Downey, physical therapist and physician advocate. They all wrote the Kevin MD article, focusing on well-being versus wellness, what it means for physicians and their patients. Now, I'm going to ask each of you just to share some take-home messages that you want to leave with the Kevin MD audience. Nikolai, why don't we start with you?
I would say the number one takeaway is really look at your relationship with rest, view that it's part of the process. Just like Tonya is saying, and like you have said as well, Kevin, the nature of being a physician is there's so much natural perfectionism and performance orientation that is built in. And to know that what serves you in one aspect of your life also sometimes is not so much in other aspects. And I don't think it's about turning those parts off completely. It's about learning just when to honor the performance orientation and when to resist it and be okay with maybe some of the guilt or the uncomfortable feelings that we're talking about, and trusting that if you can, on the other side there is more well-being and more just recovery and nourishment.
Tonya, your take-home messages.
I think a couple. One is really starting to look at putting the perfectionism on a dial. You don't have to stop striving for excellence. We're not trying to change the core of who you are, but like putting it on a dial and dialing it down or up based on the situation on hand, and starting to play with that can be very useful. The other thing is start to look at the mindset. Start to, what are the narratives you have, and start to challenge them just a little bit, push back. And then a couple of things I didn't say, but I think one is a practical tool. If you go to Duke's, if you Google Duke Wellbeing Toolkit, they have these nice bite-sized, do something for a couple of minutes, 15 days, and evidence-based makes a big difference. So for those of you who are just feeling really crispy, easy to like access. And then the last thing I want to highlight is the concept not only of shared responsibility of our well-being, our system's own part of the well-being for their care, their providers and their caregivers. And we cannot advocate, give up on our own well-being. We have our own responsibility, but also shared power. They have power over there, but boy, do you have agency over your own well-being that you may not even give yourself credit for. So those are mine.
And Kim, one with you, your take-home messages.
Sure. So my hope is that this conversation will genuinely impact how you think about well-being. Take time to pause and really think about, what does well-being mean to you as an individual, and what does it mean to each of your patients as individuals? And one specific example for physicians, and we've been talking a lot about rest, is that I recently communicated with a doctor who has a side business, and they decided that one thing they need is more rest and sleep. And they've been spending up to an hour a day engaging on social media related to their side business, but they're going to try reducing their time on the platforms, and that'll give them more time for rest and sleep, is what they need right now. And that's just one example specific to that physician, though you can use it to think about ideas about what you could do to honor your own personal needs at this point in time, because it's dynamic. And a specific example when having conversations with your patients is think about how you could support them as individuals with their own well-being. And for example, you could use a motivational interviewing question. And we've had Bruce Berger on talking about motivational interviewing. And if you don't know what that is, you can even Google, like instead of just saying it would help your patient if they lose 10 pounds or offer meds as a first solution if they're struggling for sleep, you could even Google what are good motivational interviewing questions, about sleep or about losing weight. And although you likely don't have the time or the bandwidth to be their primary support with these issues, by asking the right question, you could offer to refer them to someone who does have the time, whether that's a registered dietitian, a sleep medicine physician, a physical therapist, an exercise physiologist, or a mental health counselor. And you want to support your patients, and by asking the right question, you can, and they'll get the support they need, and the other professionals will appreciate your referrals, and everybody wins. And everybody wins when physicians are well.
Everybody, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank
Thank
you.
you.